My name is Kim Bell. I'm a doctor of physical therapy. Okay, so when I first talked to Miriam about offering this presentation, we were brainstorming on what would be the most helpful topic because, of course, there's a lot of different aspects of balance and dizziness and things that can affect you after a concussion. And the thing that I wanted to focus on tonight is what's called Bppv. This is the most common inner ear condition that causes dizziness, vertigo, and balance problems. And in my clinical experience as a physical therapist, I think this is a covert cause of dizziness after concussion, meaning it's often hidden and not identified. So I want to make sure you know about it. My mission as a doctor of physical therapy is to rescue mismanaged and misunderstood people with dizziness, vertigo, imbalance, and chronic falls. I personally endured my first severe concussion when I was in first grade and have had trouble with dizziness, vertigo, balance problems since then. And I didn't actually figure out all the components of my challenges until I was about 35 years old. So once I basically solved my own case of what was happening to me, I started this specialty practice and I decided to go out there and help people like me who may be struggling day to day and going from doctor to doctor without answers as to why they're suffering with these symptoms. So the topic really is going to be focused on dizziness. And just to talk about a little bit of terminology here, dizziness is a feeling of being lightheaded, maybe a feeling like you're about to pass out. There's actually no medical definition of the word dizziness, but it's a common term used by the general public when you kind of feel foggy in your brain. The term that is more of a medically defined term that's related is vertigo. And vertigo is a feeling of movement when you're actually still, like you're lying down, you're sitting still, or you're standing still, but you feel like you're rocking, you're spinning, you're sliding, you're tilting, or you're swaying. And vertigo can also be an unusual perception of normal motion. So you think you're walking straight, but when I look at you, you're actually walking off to the right, or something like that. So vertigo has to do with your perception of movement, and dizziness is just sort of a general term that the public uses, but a lot of people kind of cluster those together and they do overlap some. For the purpose of this conversation tonight, I may use those terms interchangeably, and the audience that I'm speaking to is people with these symptoms. So I know some of you may be family members or caregivers of people with dizziness, vertigo, balance problems from a concussion. But when I say the word you, I'm talking to the individual that has the symptoms, just to clarify the terminology. So the biggest thing with regards to treating dizziness or vertigo is that we need to figure out why. And that is important because that will direct the treatment interventions. The treatments need to be specific to the cause. So some common causes of dizziness after concussion include medication side effects. A lot of times people are put on medications after concussion, and if you look at the side effects of the medications you're on, a lot of medications cause dizziness. So you can check that out, and that may be a common cause of dizziness after concussion. That's something a lot of people already know about. Another cause of dizziness or vertigo after concussion, of course, is the actual injury to the brain or the surrounding connective tissue or the chemical effect that has occurred in the brain as a result of the concussion. So, of course, the actual brain injury can cause dizziness as well. And those are two things that I think people are pretty familiar with. But sometimes, it's limited how much improvement they can feel by doing interventions related to changing or reducing medications, because sometimes you have to stay on these medications. And sometimes you can try things that are meant to heal your brain, but yet you still are feeling dizzy. And that can lead to discouragement, hopelessness, and confusion for a lot of people. So the reason I want to share this message with you is because I want to offer you some hope about the most common inner ear condition that causes dizziness after concussion. So this right here is a picture of the inner ear. So if you kind of take your fingers, your index fingers, and put them on your cheekbones right in front of your ear holes, that is the bone that we're looking at right here. So this is sort of a slice of the head, and we're looking at the ear. And then if you go deep into the ear, into that cheekbone, which is sort of that white meshy part of the diagram, that's the cheekbone, then the inner ear is deep to that. It's the one that it's the area that has the green nerve on it that you can see there. So that's the inner ear, and that's also called the vestibular system. So Bppv may be a new term for you, and that's the reason I wanted to make this presentation, is to bring this up and bring this to your awareness. Bppv stands for benign paroxysmal positional vertigo. Now that's a mouthful. So let me break this down for you. Benign means it's not a disease or a pathology. It's a benign condition. However, I've met people that have had this for a long time, and it can cause depression, it can cause lack of physical activity. And so the effects of having it untreated are certainly not benign, but the condition itself is considered benign. Paroxysmal is a big fancy word that means it comes and goes. And then positional, meaning you feel vertigo, meaning you feel the spins or the waves of dizziness in certain positions that cause it to come on. All right, so that's benign, paroxysmal, positional vertigo. That's the focus of our topic tonight. Here is a close-up of this condition. So this image is courtesy of the Vestibular Disorders Association, and they are a nonprofit that advocates for people with dizziness from their inner ears. And so they have this diagram here. You can see down at the bottom, there's a little cluster of crystals, and that's the close-up. And then there's an arrow of the crystals that are sort of sitting in the bottom of the vestibular system. So this is a close-up of the vestibular system, sort of a zoom in of the last diagram that I showed you. And we have a vestibular system in our right ear and also in our left ear. And in both ears, we have this same setup. So we have, if you look at the top of the screen, we have an anterior canal. Off to the right of the screen, it says posterior canal. Kind of right in the center of the diagram, it says horizontal canal. And then a little bit lower in the center of the diagram, you can see the word utricle, U-T-R-I-C-L-E. Well, what can happen is there are crystals, they're made out of calcium carbonate, and they are supposed to be in the utricle, on that slightly gray area. That's where they live, and that's where they're supposed to stay. However, if the crystals become dislodged, then they can sink down into these canals. So they can go most commonly into the very bottom, which is where you see that close-up, and that's the bottom of the posterior canal, is where we find the crystals about 85 to 90% of the time. They are not supposed to be there, and that is what causes Bppv, is the crystals being out of place. The crystals can also go in the horizontal canal about 10 to 15% of the time, and they can go in the anterior canal anywhere from 2 to 5% of the time. Now, this is a screenshot of a blog that I've published on I have a website called vertigodetective.com. And that's an informational website that I put together that I publish blogs, and I have a glossary of terms that I'm developing on there. And this is a blog that I wanted to bring to your attention. It's called Bppv Symptoms, What to Know. And I have a lot of information on this, and it also links to other blogs I've published on this topic. So now we're going to go through some more details on Bppv. Some things Bppv is associated with in relevance to concussion is it's associated with sports injuries, hitting your head during sports, getting into car accidents. Even if you don't hit your head, if you just have a jarring impact, that can be enough to shake those crystals loose in the utricle and cause them to float out into those canals where they're not supposed to be, and that can cause Bppv. Now, there are other things that can cause Bppv, such as normal aging of the ear and hormonal changes in men and women that occur in puberty and middle life or end of life there, like menopause and metopause, things like that, changes in barometric pressure. There's a lot of things that can cause Bppv. And if you want to learn more, you can look at that blog I just mentioned, but I'm sticking to what's specifically relevant for the topic of concussion. This is a pretty big list, and I apologize for it being a little overwhelming, but the reason I put this up here, this is a screenshot of the blog I just shared, Bppv, What to Know. And the reason I want to read this to you verbatim is because I want you to see how Bppv has very similar symptoms to post-concussion syndrome. So bed spins is something specific to Bppv. Vertigo when lying down or rolling over in bed or triggered by a change in head position.
Dr. Bell, quick question. What's bed spins? What does that mean?
Bed spins is just what the public calls like spinning while you're lying in your bed. So that's just like a kind of like a street term I've learned from my patients. They say like, I've got bed spins, you know, and that means like they lay in their bed and they spin. It's not a medical term. People commonly will say that. So good question, thanks. Yeah, feel free to jump in if you have another question as I go. So with Bppv, typically people feel like their symptoms are worse in the middle of the night or first thing in the morning. They complain of intermittent dizziness. It can be constant dizziness. Like I have a patient right now who had constant dizziness for 2.5 years at the onset, and now 30 years later, he still has it, but it's intermittent, okay? And I'm treating him for Bppv, which we think he had since he was doing college athletics. Loss of balance, blurry vision, and falling with head turns. Dizziness looking up or down, and that can also cause loss of balance. Feeling unsteady or off balance, especially walking in the dark. Disequilibrium, which means just not feeling centered. Bumping into walls, difficulty walking, foggy brain, unexplained repeated falls, even if you don't have dizziness or vertigo. Difficulty with short-term memory, concentration, difficulty reading, problems with word finding while talking, feeling spacey all the time, but maybe less in the afternoon, having a fear of falling and seeing blurry patterns, wavy patterns, or thinking stationary objects are moving when you turn your head quickly. That's called oscillopsia. And then can also cause nausea and vomiting, especially in the acute stage. So what I want you to see, even though that was a mouthful, is that this is very overlapping with symptoms of post-concussion syndrome. And in my experience, I've met a lot of people that were diagnosed with post-concussion syndrome and took that to be the only cause of their symptoms like this, when actually they also had Bppv that was not recognized or treated. Okay, so common positions that trigger Bppv. So for example, the cognitive challenges that go with Bppv, the unsteadiness, feeling off balance, that can be a constant thing. But the waves of dizziness or the spins, so-called bed spins, may only occur in certain triggering positions. And here's some common triggers. Lying down flat on your back, looking up, such as putting in eye drops, looking down, rolling on your side, that's the bed spins again, quick head turns, and getting up from bed. So these are common triggers that may cause a wave of dizziness, but people often dismiss it because the dizziness or the spinning feeling goes away within a few seconds, typically within a minute. And so people just kind of blow it off, they disregard it, and they don't realize it's actually indicating a condition that is treatable. So here's some pictures. We're going to get away from the text because I know that's a little overwhelming. So if you're getting waves of dizziness when you're lying down or rolling over, that might be Bppv. When you're walking, if you turn and look over your shoulder and you lose your balance, or you feel like you lost your visual focus, your eyes lost focus and they had to refocus, or you had a visual lag and you had to catch up with your vision, that might mean you have Bppv. It's possible. Of course, there's also the concussion and maybe visual issues that can be related, but these are common triggers of Bppv that I'm going through here. Reaching up, looking up can cause symptoms if you have Bppv. Something like this, like painting the ceiling, for example, working overhead, bending over to empty the lower rack of the dishwasher, reaching into the back of the dryer. This is actually a really common complaint, and often a milestone that I set for my patients when we're working on their recovery is, can you reach into the back of the dryer without getting dizzy? And then we know probably you're done with your therapy. Walking in the dark also, so like people that can't balance when they're walking in the dark, and therefore vision is removed from the story. So this is really a vestibular issue. Of course, the brain injury always kind of complicates things, but definitely people with Bppv have trouble walking in the dark. So those are some symptoms and some ways to recognize that you may have Bppv. Now, I want to mention, I have a blog also on this Vertigo detective website called Vertigo Home Remedies. This is something I've put together. This is not evidence-based. This is based on my experience and my patients sharing. Some examples are how to deal with nausea, maybe using like ginger or peppermint. One thing I found that helps is putting an ice pack on your neck at the base of your hairline and sitting still for about 20 minutes. That can reduce symptoms of Bppv if you've been triggered. Also, there's a technique I describe in this blog called the active resting technique. Active rest. This is what I teach to all of my patients to manage their Bppv related vertigo. And the active rest, basically, it's described in this blog if you want to check it out and find the notes, but I'll tell you, it's just to sit still with your head straight and stare at a vertical line and just relax for about 20 minutes and because your vestibular system is triggered by movement. And if you stop moving, then eventually it will settle down, okay? So I want to let you know there is additional information on this website about home remedies, but ultimately the home remedies are just to make you more comfortable. You want to figure out how to resolve this and get it treated. So that's what we're going to talk about next. Many of you may have heard of physical therapy. You may have gone to physical therapy, especially for brain injury recovery. You can go to physical therapy at a hospital, at a rehab center, at an outpatient clinic. Maybe you even had a physical therapist come to your home. And I want to let you know there's a specialized type of physical therapist that treats Bppv, that actually treats all kinds of dizziness and vertigo, but Bppv specially. And this is what I am. This is called a vestibular physical therapist. So you may remember I said the inner ear is called your vestibular system. So the vestibular physical therapist is going to be like a specialist within physical therapy. So for example, you know, within medicine, you have your primary care doctor. They're sort of your general doctor, but then maybe you go to a neurologist for a specialized exam for your brain. Well, same within physical therapy. We have general physical therapists, but then we have specialized physical therapists for different problems. And if you're having dizziness, vertigo, or balance problems, you want to see a vestibular physical therapist because they're the ones that are specialized to test you and treat you for this Bppv. And if you go to a general physical therapist, chances are they may not know what to do. So when you go to a vestibular physical therapist, what they're going to do is they're going to consider your symptoms. And they're going to look for the root causes, okay? And I already mentioned a handful of root causes: medication side effects, the actual brain injury, maybe some visual problems like binocular visual problems, and then inner ear. Those are all things to consider. Blood pressure. There's a lot of things to consider. And so the vestibular physical therapist needs you to help them. Here's how you can help. You want to let them know your symptoms onset, trigger, and duration. So you don't have to do the best description of exactly how you feel in terms of like, oh, I feel foggy, or I feel spinny, or I feel wavy. Like, the exact experience of what you're feeling is not as important as the data here. When did this start? What's triggering it? And how long does it last? And so you want to kind of have a timeline of what makes you feel more dizzy, what are you doing, and how long does it last? And that will be what the vestibular provider needs to do the root cause assessment. The other thing you want to let them know is what activities seem to be triggering you, like making you feel worse. Some of the ones I already shared, for example, turning and looking back, lying down in bed, reaching in the dryer, things like that. What's triggering you? What movements are you avoiding? Like, I have some people tell me, like, I'm driving, but I will not check my blind spot because it's triggering me, you know? So what is triggering you? What movements are you avoiding? Because that's going to tell us a lot of information. And then how is this affecting your quality of life? For example, I had to drop out of school, or I had to get special accommodations at my employer, you know, I can't drive anymore, you know, things like that. That's all what you want to report to your vestibular physical therapist to help them direct their exam and help them set goals for you. The vestibular physical therapist should do a root cause analysis. This is what I do with all my patients on the first visit. And they're going to look at what is triggering and contributing to your symptoms. And then once they figure that out, then they're going to offer treatments that will target those problems. And hopefully Bppv will be part of what they find, because it is something that can be treated to resolution. The physical therapist, the vestibular physical therapist, will also do a hands-on exam where they will do an assessment of you, and that's part of the root cause analysis. Certainly, they'll value any diagnostic tests that you've had, but you may have already found that a lot of times the diagnostic tests come back all clear. A lot of times nothing's showing up on the MRI and the CT scan or the cervical x-rays. And so a lot of times there's not much to be found on there. But if there is significant findings that you have on any of your diagnostic tests, certainly bring that with you to present to the vestibular physical therapist, but they'll do their own exam. And actually, research shows us that a hands-on physical exam is superior to diagnostic testing for patients with dizziness and vertigo in terms of inner ear problems. So here's the good news. If you turn out to have Bppv, which is the crystals loose in your inner ear, it can be treated to resolution in 1 to 2 treatment sessions about 85 to 90% of the time. So that's pretty awesome. And that's why I want to make sure you know about it, because even if you have other causes of dizziness, like your brain injury or your visual system or your blood pressure, just reducing or resolving this piece of the puzzle may improve your quality of life significantly. I will comment here that when we say simple Bppv, we mean like crystals are only in one canal in one ear. And when I treat people with post-concussion, frequently I find they have crystals loose in both ears, the right ear and the left ear. That's also research supports that people with traumatic brain injuries and concussions frequently have Bppv on the right side and the left side. So oftentimes you do need more than this, just 1 to 2 sessions. Probably people I see with concussions usually need like 6, 7, or 8 treatments, because we're treating both ears, and a lot of times the crystals are spread out inside their inner ear. They're in multiple canals. Okay, so it can still be resolved, but usually they just need more treatments than someone who, say, just woke up with vertigo randomly and only has it in one canal in one ear. So I want to point out to you about Bppv, because this may be the missing piece of the puzzle in your case that you haven't ever heard of or thought of before. An average patient with dizziness sees between 3 and 4 different doctors to get an adequate diagnosis. So if you've already been to multiple providers and, you know, neurology, ENT, concussion specialist, chiropractor, physical therapy, this and that, don't be discouraged, because you may just need to keep seeking care, and a vestibular physical therapist may be the next step for you. There are also physicians who specialize in Bppv. They're called otoneurologists, which is an inner ear neurologist, or neuro-otologist. That's a neurological ear, nose, and throat doctor. So it's a subspecialty within ENT and neurology. They're not easy to find. But here's how you can find them. Whether you want to look for a physical therapist or a doctor that specializes in Bppv, you can search for providers here at vestibular.org. They have a provider directory, and you can put in your zip code or your city and state and hit search. And you can also search by specialty, or you can just search for anyone in your area and then look and see what you can find. One thing I want to mention about getting treated for Bppv is that sometimes it's a bumpy road. A lot of times you have to do maneuvers and exercises that are very uncomfortable. Your symptoms will probably be triggered during the treatment, and you may even have like a hangover effect afterwards, where you feel kind of yucky for a couple days. It can cause stress for people. It can cause anxiety. It's not an easy thing to go through in terms of recovering from Bppv, but the only way through it is through it. So you just want to make sure you find a provider that you trust and go with their treatment plan. If you want to learn more about Bppv, I want to share with you some trustworthy resources. Vestibular.org is that Vestibular Disorders Association that I mentioned. They have a provider directory, and you can find a lot of free helpful information on their website. That's a great resource. Also, neuropt.org. This is the Academy of Neurologic Physical Therapy within the American Physical Therapy Association. So I'm a member of both the vestibular.org, and also I'm a member of this professional association. We have a special interest group for people who treat vestibular disorders, which is the inner ear. And we have a section called Patient Education Fact Sheets. Miriam is going to share with you in the chat a link to the fact sheet they have on Bppv, which I think is very good. And she's also going to send a link in the follow-up email to the fact sheet on Bppv from this group. Also, I want to mention, at this website, neuropt.org, they also have a list of physical therapists across the United States that you can search to find a provider that specializes in vestibular rehabilitation, which is vestibular physical therapy. So this is an option for online searching for a provider, and then that vestibular.org is an option for searching for a provider. Vestibular.org includes physicians and audiologists and other professions. This one is just physical therapists. I also want to mention, I have two websites that have a lot of free helpful information. This one is my main website, betterbalanceinlife.com. I have a press page on this website that has a lot of television shows, podcasts, webinars, and other video content that I've created to help you learn. And I have about 100 blogs published on this website and counting right now. So that's a good resource for you. And then I already mentioned my other website, vertigodetective.com. And I have about 45 blogs published there. And I'm publishing on both websites every month. So you can learn from those two websites as well. Now, I want to mention a couple pitfalls that you want to avoid if you think you have Bppv. These are some kind of snares that people hit along the road. So I want to just mention these briefly, and then we'll wrap up here. So one thing is, if you go to a doctor and they give you a handout and they say, try this exercise, okay? This is something to take caution with. I have met a lot of people who have been handed a handout from a doctor, and they've tried certain exercises and they've made themselves feel worse, or they've just repeatedly triggered themselves without doing anything to help themselves. So if someone is going to teach you an exercise, they should go through it with you. and make sure you're doing it right and that you know how to do it before you try it on your own. I would take caution if someone just hands you a sheet and tells you to go home and try this exercise. Also, I would encourage you to take caution with finding videos online for Bppv on YouTube and trying to treat yourself. This is generally not a good idea because you need to have an assessment. You need to figure out, are the crystals in your right ear or your left ear, and which canal? You have to do the maneuver for the correct ear and the correct canal, and these maneuvers are based on precision. If you don't do it right, it's not going to work, and there's other things that can cause dizziness besides Bppv. So I do not support the idea of searching for videos online and trying to treat yourself. I've just met too many people that went wrong with trying to do that. And so I advise you to take caution with that. Also, the third thing that can throw people off and become a snare related to Bppv is if you've gone to somebody who's tested you for Bppv and they've told you, oh, you don't have it because you didn't have any nystagmus. You see this, this big word up here in the upper right corner of the screen, nystagmus, Nystagmus, nystagmus. That means involuntary eye movement. And if somebody tested you for Bppv and said, well, you don't have it because you don't have nystagmus, I just want to let you know there are people who have it without nystagmus, okay? So I commonly see people that are getting missed because they don't have eye movement. Well, guess what? Guess what can block eye movement? First of all, a problem with your brain, okay? In order to have the eye movement, you have to have a normally functioning brain. If you have a brain injury, you might not have the nystagmus. Second of all, medications can suppress the nystagmus. Guess what kind of medications suppress nystagmus? The ones that suppress the brain. So a lot of people are on medications after a concussion that are neurological or maybe emotional, like anti-anxiety, antidepressant, different psychiatric medications, different neurological medications. If you're on any medication that affects mood, cognition, or brain function, that can suppress the nystagmus, okay? So just because someone tells you you don't have eye movement does not mean necessarily that you don't have Bppv. And I find a lot of people who've been misinformed about that. And I want to let you know it's possible to have the crystals without eye movement. However, textbook classic, of course, we do look for eye movement to diagnose it. Okay, so that is a gold standard, is to see the involuntary eye movement in the trigger position, but it is possible not to have eye movement and still benefit from the treatment. So my main message about this is if you're having dizziness, vertigo, or balance problems, don't lose hope. Bppv could be the missing puzzle piece for you to get relief. I want to use this as a sign to encourage you. You can look more closely at the resources that I provided, such as the blog I mentioned on home remedies or the blog on Bppv symptoms, what to know. I have a lot of information on my websites on Bppv. And if you want to learn more from me, I have 3 shows on UCTV, that's University of California Television. They're all 3 UCSD Stein Public lectures. 2 of them are on dizziness and vertigo, and 1 of them is on preventing falls. So you can find these linked on the press page of my website, betterbalanceinlife.com, or if you go to UCTV, you can find them by searching my full name there, which is Kimberly Bell with an L-E-Y. It's an unusual spelling, but you can find them on UCTV by searching that name. And now we have some time for questions. So if you have questions, you can feel free to pipe in or you can put them in the chat box. And if you want to find more information from me or contact me, please visit my website, betterbalanceinlife.com. Thank you all so much for your attention.